Sadly, New Zealand has had its first death linked to COVID-19 on the West Coast early this morning. The death was in a woman in her 70s who had initially been admitted for what was thought to be influenza, complicated by an underlying chronic health condition. As we have seen around the world, COVID-19 can be a deadly disease, particularly for older people and those with underlying pre-existing health conditions. All of our thoughts are with their family and loved ones at this time. As a result of the initial diagnosis of influenza in this person and the subsequent confirmation of COVID-19 a couple of days later, there was a period when staff treating the woman were using protective equipment suitable for influenza but not for COVID-19. Once the diagnosis was confirmed, staff undertook a range of measures to protect both themselves and other patients. But as a precautionary approach, the DHB has placed 21 staff into self-isolation for the balance of the 14 days since they last had contact with this person. Understandably, the family would like to take time to grieve, and they have asked the media to respect their privacy at this time. Our health system will continue to do everything it can to help patients with COVID-19. We have sufficient hospital capacity to manage our current and projected cases, and we have plans well in place to boost capacity if needed. This latest sad news reinforces our move to Alert Level 4 and the measures we are all taking to prevent spread, break the train of transmission and prevent deaths. There were 63 new cases of COVID-19 in New Zealand overnight until 9 o'clock this morning. That is made up of 60 new confirmed cases and 3 probable cases. I can also confirm that there are now 56 people who have recovered from COVID-19. We currently have 9 people in hospital with COVID-19. There are 3 in Wellington Regional Hospital, 1 in Waido Hospital, that's in Blenheim, 1 in Nelson Hospital, 1 in Whangarei Hospital, 1 each in Waikato, Taranaki and Dunedin hospitals. One of those people is in ICU on a ventilator, and for privacy reasons we won't be providing other details on these patients. Our labs continue to process and report test results as quickly as possible, and over the last 7 days the average daily test numbers was 1,786. A reminder that anyone who has been tested for COVID-19 is expected to be in careful, close self-isolation, including from their family members, until the result of that test is made known to them. We are still seeing a strong link among our cases to overseas travel, as well as links to confirmed cases, and we continue to investigate several possible clusters. Details about the new cases will be provided on our website as they become available, as well as any clusters that we are investigating. So the combined total of confirmed and probable cases in New Zealand is 514. Today, a reminder to you that we are seeking physical separation, not social separation. Be supportive, reach out to people, and most importantly, be kind. And finally, as Wellington Hospital Intensive Care Specialist Dr. Paul Young said today in the media, if New Zealand pulls together as a community and stays at home, you will save more lives than I will in my entire career. Thank you. Over to you, Prime Minister.
Thank you, Director General. Good afternoon. As you've just heard, we have had our first death from COVID-19. And I know the thoughts of everyone from around the country with the family of this person. This will be an enormously difficult time for them, and I do ask that we respect their privacy as they grieve for the loss of their loved one. It is a very sad day, but it also brings home exactly why we are taking such strong measures to stop the spread of this virus. Left unchecked, it runs the risk of taking the lives of many more people. Even with the measures we now have in place, we will continue to see more people get sick because of the time it takes for people to become unwell after they have picked up the virus. Our older New Zealanders and those with underlying health issues are by far at the most risk. It is critical that we all stay at home to give our older New Zealanders as much protection as we possibly can. And our shield of protection for these people is physical distance. But as the Director General has said, that doesn't mean we cannot be there for them in other ways. Keep in touch on the phone or via Skype. Do all you can to help keep their spirits up without coming into physical contact, whether it's dropping food at the gate or leaving messages. Today's death is a reminder of the fight that we have on our hands, and it's a reminder of why it is so important. And everyone can play their part through the simplest of tasks by not having contact with people outside of your bubble. Stay at home, break the chain, and save lives. I also want to re-emphasise the need for kindness and support for those who have had or currently have COVID-19, after hearing reports of comments online that I would say amount to bullying. This virus could affect any one of us and any one of our loved ones. And I know that if we were in that position, it would be difficult enough without having to face the unjustified judgment of others. There are 514 people who are or have battled this illness, and they deserve our support, just as we would for anyone who is sick and in need. I also want to touch on enforcement issues. I have seen, as you will have, reports of New Zealanders not following the rules of the lockdown. And this group we can all rightly feel very frustrated with. I spoke with the Police Commissioner this morning, who has confirmed that the police have all of the resources they need. That includes the power to arrest and detain if needs be. No one wants that. So I ask that people follow the rules in the same way that the majority of New Zealanders are. Many Kiwis I know are keen to ensure that collectively the rules are being followed. Some are trying to encourage that by calling 111. In fact, over 2,000 calls have been made in order to have the rules of self-isolation enforced. Police have today launched a new online form which the public can use to report level 4 restriction breaches. The online form can be found at 105.police.govt.nz. It can be used to report isolation breaches or cases of businesses continuing to operate when they are not part of the essential workforce. The Police Commissioner has urged people to use the online form instead of calling police. That enables them to triage those calls which are most critical and most urgent, whilst also giving people the ability to share where they have concerns that people are not following the rules. We know people want to do the right thing if they see people flouting the restrictions, but this enables us to ease non-emergency phone use. Police will take the information reported online and make contact to remind those breaching the restrictions of their responsibilities. Finally, the COVID Cabinet met this morning to discuss our border measures and the management of New Zealanders returning from overseas. Yesterday, 840 roughly people arrived back in the country, primarily from Australia and the Pacific, and it's expected that roughly 300 will arrive today. These numbers have been falling dramatically following an initial influx after the lockdown was announced. As you recall, we have stepped up the requirements at the border, and anyone who is symptomatic or does not have an adequate self-isolation plan are essentially quarantined. I know this is causing concern for their families, and I do acknowledge that concern. We have to keep in mind, though, that returning New Zealanders, through no fault of their own, do carry the greatest risk. We continue to work through ways to manage this risk and meet the needs of returning travellers as best we can.